Hi, my name is Chastka, and I am a pelvic floor physical therapist at Ladybird Physical Therapy. So today, this is the second video of our Prolapse YouTube series, and what I'm going to do today is I'm going to bust two different myths, okay? These are common assumptions that I either hear from my patients or that I see online, and so I just want to clear those today. And so the first one is like, what is a prolapse safe exercise? And truthfully, the answer is it depends. Some exercises are fine for one person, but not fine for the other. And the reason that they're not the same for everyone is because it depends on like your symptoms. Like, does that exercise, that movement create a symptom for you? Very generally speaking, I would say if it doesn't cause a symptom, it is probably safe for you to do. And that goes along with like, some people will ask me like, are squats safe to do? It's like, let's try it. Do you have symptoms? No? It's like, okay, probably is okay. Same thing with weightlifting. It's good to do kind of like a graded approach, but as long as you're not having symptoms, probably is okay. And same thing with jumping, with running. A lot of times one of those things is going to affect you if you do have a prolapse. So I'm not saying that those things like could possibly worsen a prolapse, but they don't for everyone. And that's why if you see something that says, never do XYZ if you have a prolapse, that's just simply not true. It's like eventually you can get back to those things. And that's where seeing a pelvic floor PT is really helpful, because we can figure out like what exercises are safe for you. And then how assessing you as a person to see like how do we get back to the exercises that do cause problems and symptoms for you. And again, those symptoms can be like heaviness, leakage, not really a symptom that you feel with exercise, but not emptying your bladder or bowels is another symptom of prolapse. But a lot of times I'm working with people to get them back to doing their exercise, like running, jumping, weights, things like that, without prolapse symptoms. So that's why, again, there's just not a perfect answer of what exercises is safe for prolapse. It depends, but that's why you want a plan that is specific to you. Okay, the next one is, and it's not really like, it's an assumption, it's like everyone should do kegels, okay? And a kegel is a pelvic floor muscle contraction. And while, some people do need pelvic floor strengthening, I would say that is a piece of the puzzle, that is a slice, that's a part of the story. But there are so many other things to look at. I would say what's just as important as strengthening your pelvic floor is reducing the pressure from above. If you listen to the first video, I talk about how increased abdominal pressure is what causes that like lengthening of the ligaments and causes organs to fall into the vagina. And so if for some reason you're still having increased abdominal pressure with different exercises, constipation, whatever, you're just gonna either keep making it worse or prevent it from getting better. And so reducing that pressure is very, very important. And there's different ways to do that. And that's where, again, the assessment is really helpful. The other things I would say is like, in addition to strengthening the pelvic floor, it's like, are the pelvic floor muscles tense? And that's why they're weak. Sometimes we have to lengthen before we contract. Also, it's just not always about just the pelvic floor. It's, do you have a strong glute muscles? Do you have good hip rotators? Like the muscles that support the pelvic floor, I would say that is also equally as important. And so while I would say like, yes, doing kegels like may be helpful, and it is helpful for some people, for a lot of people, it just doesn't take away everything, okay? So if someone tells you like, oh, you could probably just do your kegels and you'll be fine, it's like, well, you might want to get a further, more specific assessment. And so I hope that was helpful. And really the summary of this video is like, okay, there are no specific exercises that no one can do if they have a prolapse, okay? And not everyone needs kegels, and sometimes people need more than just strengthening their pelvic floor. So thanks for listening. Look forward to future videos about prolapse.